Okay, well, the pelvic floor muscle exercise. So if everyone's sitting at the moment, I'd like you to, first of all, just think of letting go of any tension in your belly and your buttock muscles. And we're just really going to try and think of doing all of this very gently and not with any gusto. So the goal is to relax your belly and your buttock muscles. And now to think of what it's like to be busting to do a wee, or that sensation of wanting to hang on. I'd like you to think of tightening the front passage or the urethral sphincter like you're stopping the flow of urine. And I just want you to very gently squeeze this here and then let it go. And it's just very gentle. Next, I'd like you to think about what it's like to be, in fact, standing in front of a mirror and looking at yourself naked. And as a guy, just very gently drawing the testes up and the penis in, like you're retracting or shortening the penis. So that's using another component of the pelvic floor. And then thirdly, just to be aware that we do have that rectal or anal sphincter that we can also strengthen, particularly if you're going to be having radiation therapy. So that's just gently tightening the muscles around the anus and just a very gentle squeeze. Now, it's actually really important to know that we do have those three distinct areas. And so we're going to actually have a bit of a practice here. If you have the opportunity to stand up, I actually like patients to do it in a combination of postures. And for most of the training, standing is actually really good because you can see things in the mirror, but you can also strengthen muscles more quickly. And particularly if you're going to have something like a prostate cancer surgery, you'll get more benefit from in the standing posture. So just doing that all together, relaxing the belly and the bowel. Think of gently tightening the front passage as if you're stopping the flow of urine. Gently draw the testes up and the penis in, and then gently tighten the muscles around the anus. And now just gently let all of that go. And what we're going to do is just try that quickly about 5 times. We're going to go squeeze, draw up and in, and let go. Squeeze, draw up and in, and let go. Squeeze the front, draw up the testes, tighten the back passage, let go. 2 more, squeeze, lift, let go, squeeze, lift, let go. Now, straight away, I want you to, while you keep breathing, do all of that once more time. Tighten the front passage, draw up the testes, tighten the muscles around the anus, and hold. Keep breathing as you count for 1, 2, 3, 4, 5, and just gently let that go. Now, these muscles will fatigue if you don't give them a rest, so it's really important to give them an equal rest time. So I like patients with just general problems to have this combination of perhaps 10 quick little pelvic floor squeezes, followed by 10 holding squeezes for up to 10 seconds, and to repeat that 3 times a day. And if they have to do more, like preparing for prostate surgery, 5 or 6 times a day. So it's really important, though, that you don't brace your abdominal muscles or even move your shoulders or wiggle your hips or make any grunting sounds, because holding your breath and using all those accessory muscles is not going to help that little tiny urethral sphincter tighten up. So we've got lots of evidence that shows pelvic floor exercises in men need to have, in these days, for urinary incontinence, focusing on the front passage, not the back. But if there's any bowel issues, to also include the back passage.
The pelvic floor muscles, I certainly have seen quite a lot of men who think the more they do, the better they're going to be. And as Joe says, muscles fatigue. So it's really important that you just don't go hell for leather and do like 800, 900 a day, because they're not really going to be effective. But also there are some people out there who, and some men who can actually end up with an overly tight pelvic floor, isn't there?
Yeah, so back to the next slide there, Alan. We have a look at what we call transperineal view. So we're actually looking at all 3 muscles from between the legs and looking up. And basically in the first picture, the pelvic floor muscle combination is actually relaxed, but in the second one, it's contracted. So there's quite a change, in particular penis bulb, and also that middle part, the membranous urethra. So that's where everything kind of combines together to close off or pinch the urine, stopping it from flowing down. But some patients, some men naturally have a tight pelvic floor. So if they do too much pelvic floor training, they end up with pain or more leakage. And that should never happen. So there should never be pain associated with pelvic floor exercises. And commonly, if you're doing too many, men will often talk about an ache in their rectum, feeling like they've got hemorrhoids and almost like a golf ball shoved up their anal passage. And that's an indication that they're doing way too much and putting the wrong emphasis on things. So it's really important to know that the muscles need to relax as well as contract, and for the muscles to get strength, they need to have rest time. So it's really important to space exercises out. Maybe a couple of hours gap between each set that someone does during the day as well is a good idea.
Well, that brings us an interesting one to the pelvic floor muscle assessment. And just as an aside, I guess, is that I discovered some years ago, ladies, that I could do the assessment insofar as keeping the muscle tight, but I wasn't doing the letting go really well. So my poor old pelvic floor was getting rather tired. Is that something that's happened with your group of men as well, Dennis? Some blokes are holding on too tight?
Well, I don't know about the group, but it certainly happened to me. Yes, I got to the point where I was, after gaining a bit of continence, then I started to lose it again. So it happened that I had an appointment with my pelvic floor physio, and she put the ultrasound back on the right spot again, and she said, "Oh, your pelvic floor muscle is not relaxing at all. So you need to stop. Actually, don't do any exercises for a week and then come back and start slowly again." So yes, it is possible to overdo it, and that's not good.
No.
So the pelvic floor muscle information there, ladies, can you just talk us through those two particular movements?
Yeah, well, it's also important to know, apart from strength and the relaxation capacity, that physiologically the pelvic floor has both fast fibers that respond to things like coughing, sneezing, sit to stand activities, bending, lifting, and also endurance. So the research that I did a couple of years ago, we were able to show that if we looked at training those fast twitch ones, so the ones that you need, and in particular building up the speed. So I asked patients to perform 10 maximal contractions as fast as possible. So that's basically timing how quickly it takes to do 10 of those rapid ones. And we're looking for 1 second or less per contraction. So it's really easy. You can use a stopwatch at any time. I prefer to do the test in standing because that's when most men leak. And then get them to count out loud 1 to 10 as they keep breathing, 1, 2, 3, up to 10. Stop the clock and see how long they take. If they take 20 seconds to perform 10 contractions, they're taking about 2 seconds per pelvic floor contraction. And to be honest, that's too slow. If they go to stand up and it takes 2 seconds for their pelvic floor to switch on, they will have leaked already. So the goal is to try and train the pelvic floor reflexes to cope better with those quick actions. And then 70% of the muscles made up of slow twitch fibers, and they're the ones for endurance. So not all day, every day, but once a day, it's really handy just to do this one maximal test where you see how long you can possibly hold for. And again, in my research, I was able to show that if men could hold for up to 60 seconds, they were usually continent. And we know that often guys will struggle at 3 seconds initially, and it's just something to work towards over time. So that's called the sustained endurance test versus the rapid response test. And we've done papers to actually highlight that. So if anyone is a bit competitive with themselves and wants to do that, then it's a really good self-test to do. Yeah, I actually run a little group in Perth. It's part of the Prostate Cancer Foundation, and it's called PROST. And we've tried to make that a community-based program that anyone can access. But it's the aim of it is to always include pelvic floor exercises. So we call that functional training. So although we might be in a gym setting and doing some squats and some push-ups, or we also go out onto the ovals. We might do some kicking skills or some rope work. And the goal is to try and improve everyone's general strength and mobility for their whole body health, but also to activate the pelvic floor muscles to help with continence and sexual function. But as we said earlier, continence issues and pelvic floor dysfunction and sexual dysfunction can have huge impacts on the psychological health and mental health of everyone. So often just getting out and joining in a local gym program, if you can't access something more specifically, is just so good for that whole mood and mateship aspect of your health. So
there's also the social side of it.
The social
interaction. I've got patients who not necessarily keen on joining a support group, but especially if they're attending sort of exercise training with other men who've undergone the same kind of experiences as them, they found that really beneficial rather than just structured support group sessions, because it's not always for everyone. So the knack, it's really all about learning how to activate those pelvic floor muscles to help them maintain their continence. So especially in the instance of stress urinary incontinence. So we teach them to, brace with their pelvic floor when they cough, sneeze, laugh. Apparently getting in and out of a car is a big one. Some of my patients have said. Getting out of bed first thing in the morning. Men who've had prostate cancer surgery often find that they're dry at night before they are during the day. But it's always kind of try and remind them that yes, they're dry all night when they're lying down, but they are going to have that increase in abdominal pressure when they go to get out of bed. So it's really important that they learn to use the muscles in the right way, and so that the more that they do that, the more that it actually becomes an automatic reflex for them, really.
Yeah, and I'd just like to add as well, sometimes men are doing things with a bit too much gusto. So they might squeeze their pelvic floor before they stand and then squeeze really hard, take a couple of steps and then go get this big thud of urine empty into their pad or underwear. So I always say you've got to temper it like a dimmer switch. Think about maybe doing a 50% contraction of the pelvic floor, squeeze gently and then stand, take 3 or 4 steps, gradually release, and then you should overcome that problem. And probably the number one thing that guys struggle with is, and I've probably heard it 3 times today, is leakage with breaking wind or farting.
Yes.
And that is something you can use a knack for as well.